Please welcome to the CPAC stage my friend, colleague, and ally, Dale Bellis of Liberty Health Share. We just heard from Representative Bishop, Dale, about the importance of the Supreme Court, and we're all following that very closely. One of those landmark decisions that was made in the past few years was related to health care, and it was the Obamacare decision that said that it was not, in fact, a tax, but they could force you to buy it. As a result, millions of people have had their monthly rates increase, some by 3- and 4-fold. Why is that the case? And what kind of health care do you think Americans really need and want?
The Affordable Care Act is really nothing more than a set of government regulations by which health insurance is purchased and accessed. And whenever government intrudes into this private area of our lives, the consequences many times are enormous and detrimental. And all of the flaws that we see in the current healthcare system because of Obamacare is primarily because of that government mentality of one size must fit all. And that's the flaw in the Affordable Care Act and why it will never succeed nor get the kind of response that Americans really want for themselves.
When you use that term one size fits all, and push back on me if I'm getting it wrong, that means that somebody who, say, is 26, 27 years old, fresh out of college, working their first job, unmarried, renting rather than owning where they live, has to pay the same amount as somebody who's, say, in their 60s or 70s.
And has to have the same benefits, the same structure of a policy that a 50-year-old must have. It's just ludicrous. It avoids every natural principle that we know regarding how the marketplace works and what people want.
You know, my folks always told me when I was younger, which was a long time ago, that it was important for young people to have health insurance.
Yes.
I think that's that parental fear that, well, what if my son or daughter gets into a car accident? Then financially as a family, we may have to absorb a real financial burden in addition to worrying about the safety and health of our child. Luckily, lots of kids, they don't have that car accident. You know, Matt Schlapp, who was over here, went insurance-less for a good chunk of his 20s. I ended up going insurance-less for much of my 20s, much to my parents' chagrin. Do you think that I'm dicing with my own safety, or should I have had a plan in my 20s, and how should it have compared with maybe my parents' plan?
Options and opportunity is really what American economy is all about. In fact, the Job Creators Network just recently completed an extensive, in-depth market research on what do people want in their health care. Right. Number one, they certainly do not want government-owned, government-paid-for, controlled, top-down, one-size-fits-all kind of health care. That's what they, number one, do not want. Number two, they want personalized health care. That is, health care that fits them and their needs and how they perceive their lives and what they want, and the options and opportunity to choose that. That's really where so many of these choices in the marketplace fit in, whether it's short-term duration health plans, whether it's HSAs and high deductible plans, healthcare sharing, of course. Other options is really what people are looking for as a way to personalize and fit and meet their individual needs.
That makes a lot of sense to me. Different people need different things, and it should be priced accordingly based on what your needs are.
Yeah.
You know, we came up with this theme, America versus Socialism, right before our big annual event in Washington, D.C., just outside of Washington in February of this year. At the time, I think Bernie Sanders had won a number of those first handful of primaries.
Right.
And I think that we at CPAC take credit for making the Democrats have to deal with Joe Biden instead of Bernie Sanders. But there was something that Bernie was saying, and I'm not quite sure of why it was so appealing to folks on the left. He wants Medicare for all. He wants socialized medicine. Even as a result of that, Joe Biden has had to endorse with his plan the public option. For those of you who don't know, once you go that government route, if you've got employer-based insurance, insurance from your job, it comes out of your paycheck and your employer helps you defray those costs. 160 million people are going to be booted off of that if we go toward government health care. It means we're all going to be in the same bucket, regardless of whether we're working, whether we're not working, and what we can afford and what we need. What do you think is the appeal on the left to these ideas of socialized medicine? They compare us, they want us to be the European model. They talk about how fantastic NHS is in England, and boy, wouldn't you like to have a Canadian-style health care? I mean, I don't know a lot of Canadians or British people who are elated with the way that their health care options are set up.
Because Medicare for all sounds innocuous. But when you pose the question, do you want government-paid and controlled health care? The vast majority of Americans say absolutely not. But when put it subtly and in a way that really obscures the true nature of what Medicare for all brings, people are initially open to it because they don't really know what it means. But first of all, it means the loss, as you've just said, of every private means of meeting healthcare costs. Every employer plan, every insurance policy, certainly every other means that people follow to meet healthcare costs would be absolutely outlawed and not allowed and forced into a government plan. That's number one. Number two, the enforcement of unelected bureaucrats' ideas as to what health care should be and ought to be. We have no voice. Our individual freedoms are stripped from us, and we have imposed upon us government ideology. That's number two. And number three is the kind, as you've just said, if we want to see what government health care looks like, let's look at the places where it's been tried. I didn't say this. This is not my words. It's the Red Cross of Great Britain that said the NIH system is a human rights disaster. I didn't say that. They said that. Now, if that's what we want to introduce to America, then Medicare for all will be what we'll opt for, but we have to rise up, let our voices be heard, be engaged, and absolutely resist this socialist effort to take over healthcare.
Was Sarah Palin years ago, and she caught a lot of heck for saying this, and they said she's absurd, she's out of her mind. She talked about death panels.
Yes.
The idea that socialized medicine would eventually lead to unelected, unaccountable bureaucrats determining life and death decisions for people in your family. I think Sarah was right.
She was.
If we go down this road, what happens if people don't come together and make that voice heard? And God forbid the wrong guy gets elected here in just a few months. And next thing you know, AOC is named majority leader in the United States House of Representatives, and Chuck Schumer is then majority leader of the United States Senate. And there's very little of an ability for conservatives and for Republicans to be able to block some of these agenda items. They're going to get rid of that filibuster. They're going to make sure that they can push through whatever socialist agenda they want with just 51 votes instead of 60, is where we're headed. What's at stake? What happens?
This is an urgent and serious time, Ian, without a doubt. It means the loss of every freedom that we currently enjoy in healthcare. Gone. If we enjoy the option and choices that we experience today, making decisions about the care of our health, consulting with our physician, and having that physician-patient relationship sacrosanct and meaningful to us, of making decisions about the kinds of care that we access, making decisions between the kinds of quality and cost that is within the current healthcare system. We have the greatest healthcare system in the world. If we appreciate and enjoy and want that, then we have to resist. If we do not, if we're silent, quiescent, simply accepting and going along, we will lose our freedoms in healthcare. And it's absolutely critical.
I can hear it right around the corner if we don't get to work. Folks, one last time, this is my friend Dale Bellis from Liberty Health Share. Dale, where can folks learn more about Liberty Health Share? There's a number of us at ACU and CPAC who are part of this fine program. Where can, tell our friends here in North Carolina where they can learn more.
LibertyHealthShare.org. LibertyHealthShare.org is our website. Get all the information there. Ask for a free information packet and a toll-free number if you prefer to chat. And we have folks standing by to answer all your questions, but LibertyHealthShare.org.
Dale Bellis, you're a great American and a defender of freedom. Thanks for joining us.
Thank you.